her chief complaint. General illness is, as I said, sustained fall. I'm going to say that I'm going to verbalize them getting C-spine. So C-spine has been established. I have a C-collar on her. Then what I'm going to do is my first impression, obviously, she's going to be awake and oriented. So I'm going to introduce myself. Hi, my name's Greg. Is it okay if I do an assessment on you? Mm-hmm. Okay. Then I'm going straight to my ABCs after that. Her airway is open because she talked to me, so I already know that. Her breathing, I'm looking at it, and she's breathing in and out. She's breathing 12 times a minute, so that's sustainable. Her skin color, temperature, it all looks normal. Her circulation, I don't see any bleeding anywhere. Her pulse. Her pulse is 76, so that's good. So now what I'm going to do is I'm moving forward to my rapid trauma assessment. I'm going to go frontal, occipital, parietal. I don't see any notable injuries. She has a normal shaped skull. Temporal, zygomatic arches, maxilla, mandible. Everything looks good. Feeling all the way around. Now I'm going to palpate her C-spine. 1, 2, 3, 4, 5, 6, 7. Everything is actually in line. Now I'm looking at her neck. We would have the C-collar on, so we wouldn't be able to necessarily see it, but I would look for tracheal deviation. You'd still be able to see that because there's a hole in the collar. So you're looking through there. Everything seems normal. Everything's in the normal limits. Palpating her clavicle. Did I break the clavicle?
If you're feeling something on the left side, it's probably removed in that boy for 4 years.
It's a muscle. Alright, so now clavicle's normal. Normal sternal. Now what I'm going to do is I'm going to push in on the ribs. I don't see any kind of abnormal motion. I'm also looking for what's called paradoxical movement. In the event that 2 or more ribs is broken in 2 more places, you would actually see improper movement where one part would stay still, would stay stagnant. So then what I'm going to do is I'm going to move down for hips, pushing in. I don't feel any kind of tension, nothing abnormally noted on the ilium. Then moving down to the ischium, normal. So then I'm palpating femurs, normal. Patella's in the normal place. Then I'm going tib-fib, tibula and fibia, palpating, it's normal. And then tarsals, she has good movement. I'm actually going to push forward, push backwards. Metatarsals and phalanges all look in normal shape, and I'm coming back up on this side. Tibia, fibula, patella, femur. And then coming back up to the arms, what I'm going to do is, if I can, at this point, I'm going to check a brachial, confirm my pulse. And then this is the best way to access the humerus, so I'm going to mark out humerus. Making sure the elbow works. I'm going to check this hinge joint, check this ball and socket joint. Then coming down, radius, ulna, carpals, metacarpals, phalanges. And then I'm going to check the other side. Doing the same thing. Good motion. Good rotation. Everything feels normal. That's good. So now that's my patient assessment.